You're watching CBS 2 News. Here's the latest at 5:30.
Well, now at 5:30, the Culver City School District is making national headlines today for requiring eligible students to be vaccinated for COVID-19. Welcome back to CBS 2 News at 5. I'm Jeff Vaughn.
And I'm Pat Harvey. The mandate may very well be the first of its kind across our state.
So how do parents feel about that new requirement? Will it help keep students safe, and does it go too far? Join us live now to break it all down, Culver City Unified School District Superintendent Quoc Tran and CCUSD Board President Dr. Tasha McKeithen.
Also, Erica Von Yu, she is a parent of 2 middle school students in that district, and Dr. Richard Seidman, the Chief Medical Officer at LA Care Health Plan. Welcome to all of you. But Superintendent Tran, let's begin with you. Why did you decide to implement a mandate?
If I could just start with a different perspective, I think the mandate is a collaborative effort amongst board trustees as well as parents and teachers and union leaders. The 3 things basically is that we know masking works, we know that testing regularly also help with the understanding of the spread of the virus, and we know vaccination also works. So we're just looking for option to do all 3 better and deeper so that they are interconnecting, that they can build a safety network for the protection of our students.
So Erica, let's talk with you. You have a vaccinated 12-year-old and unvaccinated 11-year-old. So how do you feel about sending them back to campus together, and also about this mandate?
When the vaccine got authorized by the FDA, I asked my daughter, I think it's time you need to vaccinate. She couldn't be happier. My 11-year-old said, Mommy, can I vaccinate? So that was something that I knew if he couldn't get vaccinated. I asked, of course, the pediatrician if the 12-year-old should get vaccinated. She absolutely said, yes, go ahead. So my daughter got vaccinated the second day after the FDA authorized the vaccine. Sending them both now, knowing that after November 19, I believe everybody will have to be vaccinated 12 and up, I feel much better. I know my daughter is protected. They have the vaccine. My son, I talked to him several times. He will have to wear that mask as well as my daughter, but be a little bit more diligent on what they do. So I feel much better now after Superintendent Tran decided to get this mandate.
Okay, thanks, Erica. Now, Dr. Seidman, what are the benefits of a vaccine mandate for students, and is vaccination of eligible students enough to protect the entire student body?
I think it's a fantastic move that the Culver City School District has taken. Vaccinations work. They are safe. They're highly effective. Even now with the Delta variant, we're seeing this incredible efficacy. And the sad reality is the vast majority of cases right now are in the unvaccinated. The goal with COVID is we have to do everything we can do. The layered approach is the appropriate approach. We should do everything we can do. And I think Superintendent Tran said it well, that why not pursue the third most effective option on top of masking and testing? The vaccine mandate will make the school safer, the teachers, the staff, the students, and their families, as well as the community. So hats off to Culver City.
So Dr. McKeithen, let's talk to you about if there are possibly any exceptions for this mandate, religious, otherwise, anything for the eligibility by the age. And this is still experimental, of course. Are you waiting for FDA approval with that November deadline?
We're moving forward with this mandate. We are exploring different options in terms of those who choose not to or who are ineligible to get the vaccine, in terms of making sure that we don't have the learning loss. And we are creating some plans right now to make sure that we serve all of our families and children in the district.
All right, well, we know you've done extensive study on this, and you said, Dr. Tran, that you obviously, well, Superintendent Tran, communicated with the board and parents and all of this. So we're just wondering, why the November deadline? Why did you choose that month?
If I may count the backward process, it would take us a couple of weeks to spin up the possibility of unifying all of our efforts to provide vaccination opportunities at the school site, within localities within the community, as well as encouraging parents to make plans to utilize their option through their own health plan. for vaccination. So that part would take a few weeks, and then the vaccination would be fully effective with 2 doses, and sometime between the doses would be 5 weeks apart, allowing some flexibility, some deeper discussion, some soul searching for parents who are needing more information. So that's why we came up with the November 19 deadline. It seemed to be sufficient enough to put our resources together with the local communities and local clinics, as well as allowing parents deeper conversation and information to make the decision that is appropriate for their family. And that's why the November 19 date seemed to be sufficient time for that to happen.
Well, let's talk about the parent. Erica, you're a parent. Have you had deeper discussions with other parents about the vaccines? Has it been polarizing? Have other parents said that they're not going to do this?
Most of my friends' mom, we have talked about it, and everybody say, I think this is the right thing to do. I also have to tell you that most of my circle, the inner circle, everyone is being vaccinated, parents and kids. So we do not have anyone who is not them parents vaccinated, neither the kids 12 and upper. But at least all the parents that I've been talking, everybody supports the decision and is happy that it is happening.
Well, Dr. Seidman, what would you say to parents who still are hesitant to have their children vaccinated?
Well, I understand that everybody, and in the absence of a mandate, so far everybody's free to make their own choices. But I think what you're hearing on from everybody on the call on the news today is that they've done a very thorough job assessing the attitudes of the people that are served by the school district, and the overwhelming majority support the mandate. There's always going to be people that don't agree, but clearly the science tells us vaccines are safe and effective. The learning loss has a tremendous cost. What parents and families had to go through last year, we can't repeat it. And we're already seeing some schools across the nation that have had to close, doing everything they can to prevent that. The vaccination effort is going to really prevent that from happening in Culver City. So it will always be controversial, but for people not yet convinced, I would ask them to find trusted sources of truth with factual information. Don't believe the misinformation that's out there. Find someone you trust, talk to your doctor, families and friends, and pay attention to what's happening nationwide with unvaccinated people still being hospitalized at very high rates and unfortunately dying, that very likely could have been saved had they been vaccinated.
Well, Culver City, you're leading the charge, so we will certainly be following your story and what is happening in your school district. But we want to thank you all for joining us this afternoon.